10 cases of measles have been identified in Florida over the last couple of weeks. Most of them have been in a suburb of Fort Lauderdale. What information should parents have in order to make the best health decisions for their children? Unfortunately, the Florida Department of Health is not providing enough information. They're not being forthcoming. So let's talk about it. Hey everybody, it's Dr. David. We're talking about infectious diseases today. Disease, measles, which was supposedly eradicated about 20 years ago in America. True eradication never actually happened, but we also know that it was a very rare thing. So every now and then we do see cases pop up, but the fact that there have been 10 in Florida in the last 2 weeks is a bigger outbreak than we typically will hear about throughout the country. There are some that are bigger, but being somebody who's been involved in infectious diseases and pediatrics and counseling people about both infectious diseases themselves, as well as vaccination strategies for those who wish to pursue that, I thought it would be important for us to give an update on this. Now, back in the second week of February, I did a long video about measles itself, about what outbreaks are, about what the disease and what to look for, what the concerning issues are, complications associated with it, information about the vaccine. So if you do want to get more information about that, please go look at that video. I'm not going to really be covering that today. We're going to be covering really more about this outbreak in Florida. Okay, so of course, super important, informed consent. Whatever decision is, you have to weigh the pros versus the cons, risk versus benefits versus the alternatives. But what if we're not given all the information that we need in order to make that decision? Okay, so this biggest outbreak that's happening in Florida is at Manatee Bay Elementary, which is in Weston, Florida, which is just west of Fort Lauderdale. In this school, there was in the county there have been 9 cases, all associated with the school. Some of them were students. There were 2 of them we're actually not clear as to if they were siblings or just friends. We're not really sure. But again, we haven't been given that information yet. So the Florida Surgeon General, Joseph Ladapo, he is the state's top official. And he shared a letter in February, later in February, basically that the decision as to what to do for your own child in terms of keeping your kid home from school or not was up to you. Didn't make any recommendation about it, just it's up to you. Okay. Now, this does fly in the face of pediatric societies, medical associations, CDC, World Health Organization, who all say that the best way to stop a outbreak from happening is for people who are not vaccinated, people who are immunosusceptible, to be out of school for 3 weeks in order to stop the circulation. Okay. Now, and a measles outbreak, by definition, is more than 5 cases, so that clearly is that. And, a measles outbreak, that's a medical, a public health emergency. That's, this is one of the most contagious diseases out there, which can have some very catastrophic outcomes, especially in those who are weakened with their immune systems. And so to handle this cavalierly, to not approach this as a true health emergency, leaves question as to what health officials are doing. Now, there was a 10th case that just was found in Polk County. It was in a young adult. Polk County is the county that is due west of Tampa here. So, again, it's been 1 case. We don't know if there's been any spread. We haven't heard about that yet, but it's now where we can't just say it's in one area of Broward County because it has shown up elsewhere. Okay. Now, as far as overall, I just have found that the Florida Department of Health has not been forthcoming to the level that we need in order to be making the right decisions and to educating ourselves. They didn't actually provide any information at all when the first cases came out. It was actually the public school district is the one who made the first announcement. But that's supposed to be the job of the health department, health officials, in order to tell people what to do, not just the school saying, hey, we got measles. Okay. Now, the Surgeon General, Dr. Ladapo, he actually eventually, about a week after, then wrote, due to the high immunity rates in the community, as well as the burden of families and educational costs of healthy children missing school, the state health department is deferring to parents, or guardians to make decisions about school attendance. Now, at the time that the first cases were appearing, of the 1,067 students at the school, there were about 100 kids, or actually they say at least 100 kids, who had not been vaccinated against measles. Okay. Now, pretty much all of the research that I've seen, the statements from all the health departments that say, in order for there to be herd immunity for measles, that 95% of the population needs to be vaccinated, needs to be immune in order to stop the spread from one person to they're going like wildfire. Okay, but 100 out of 1,067, that's only 91%. That's not 95%. So that is a fly in the face of everything otherwise known about measles. So to say that there is high immunity in it, but I mean, the numbers are numbers. Numbers don't lie. Okay, 95, is 91 is less than 95. Pretty sure that's something we would have learned when we were in elementary school by 5th grade. But apparently, those numbers aren't the numbers according to our Surgeon General. Now, he did go on to say later that it is normally recommended. Doesn't clear who normal is. What's normally recommended? That unvaccinated students who haven't previously had the disease be kept home for 3 weeks because of the high likelihood they will be infected. Never actually went on to say that the state of Florida is recommending it normally. So I guess by definition, Florida is not normal. We're abnormal. Maybe many of us knew that already, but that's the only conclusion I can make by those two specific statements. Now, the other things that really was upsetting is, there was no information provided by the state whether the children who got the measles, whether they were vaccinated or not. Wouldn't you like to know that? Wouldn't you like to know if there were people who were vaccinated but still got it? Obviously, that can speak to the effectiveness of the vaccine. And, we do know that if a person does get a vaccine, 97% of them, of people will not catch the disease. If they do, it'll be a much more mild form of it. But, again, as a physician, I'd like to be able to counsel somebody on what is okay, of what the numbers are. They haven't shared it with us. There's no information whether these cases were in one class or whether they were spread throughout the school. Wouldn't you like to know if it was like really congregated? Because that would help to understand how it was spread. If it was just within a classroom, obviously the filtration system, the air within that room could be more of an issue. No information on whether any of these cases were siblings. So they could have been two students at the same school. But obviously, if there were multiple siblings or multiple cases that had siblings and it was circulating in the house, that would be good to know also, to know whether this was just being spread at the school or whether it was being spread at home as well. Okay. Also, there was no information about how the measles got here in the first place. Most of the time it's from international travel. Wouldn't you like to know how it got here in the first place? Again, we can make our decisions best going forward if we have this type of information in front of us, and we don't. Okay, now the goal of the quarantining of both non-vaccinated as well as immunocompromised people. Now, immunocompromised people could be people who have weakened inborn immune problems, acquired immune problems. It also could be people who have taken chemo, who may have wiped out their ability to mount immune system. So there's a couple different there. But the real reason to keep them out of school is to stop the outbreak as soon as possible. We don't want to see one case and then another week later one popping up, another one popping up. We don't want this to go on for 3 months within a school, because that means that those susceptible kids really would be susceptible because of the potential exposure for a longer period of time. Okay, if someone chooses not to vaccinate their kid, that's on them. That's on their kid if they catch it. Right now, granted, there's ways of making sure good vitamin D and zinc levels and starting our immune system. We've talked. I also talked in that last video about the use of 2 days of high dose vitamin A to decrease the severity of the disease, and all of that's true. But if you have a kid who's immunocompromised, who can't take the vaccine, or who no longer has immunity because they got wiped out from a chemo, that's a kid who could be out of school for a long time. And let's face it, that would be a kid who, if they were to catch measles, is more likely to get severely ill. Okay, so we really want to make sure that that's not popping up. But overall, my take, it's irresponsible for the Florida Department of Health to not be providing accurate information for us so that we can be making the best decisions, so that I can be counseling people on the reality of what's going out there. Again, informed consent, you're weighing the pros, you're weighing the cons versus the alternatives that are out there based upon information, not just based upon whim. And hopefully you're getting true information, which, as we've heard, there wasn't all true information here. Okay, and of course, first signs of illness, because measles starts off with a flu-like illness, like everything else, starting our immune support protocol as soon as possible. Our patients know about it. It's in our patient portal. Become a patron member of ours if you want to have access to my holistic primary care protocols, including this. And, if you like this content, click subscribe and share it with everybody else. Have a great day.